Welcome to everybody who's just joined us. We'll move along with our next session now, which is trauma-informed people management, reducing psychosocial injuries in the workplace. And that's going to be delivered by Kerry Howard, who's a principal psychologist at Psychosocial Limited.
I'll introduce you to Angus. For those of you online, welcome. Angus, the Wonder Dog, has been with me at the conference the last 2 days. Now, for those of you who might have seen us wandering around, can I just ask, and no shaming here, but who kind of looked at me and wondered why I had the dog with me? Wondered if I had a psychological injury and that's why I had the dog with me, what benefit the dog produced for me, any of that sort of stuff? Any of those thoughts going on? Okay.
Yeah, just jealousy.
Oh, well, just some jealousy. All right, we can understand that, can't we, Angus? The whole, and you'll notice there's a little bit of a theme through my presentation this afternoon. I will be quizzing you at the end to see what that theme might be. But it's an important recognition that sometimes our perceptions of why somebody might be doing something in particular in the workplace is not always accurate. And that it is our job as human beings to try and sort of work out, ask questions, find other ways to find out. And one of the things that I do as a consultant, in addition to, the sort of like temporary chief mental health advisor or whichever way, you might need somebody to ask questions of, it's also, I help organisations look at if they've got a psychiatric assistance animal coming in, how do we set policies up around that? How do we get the culture to be open and recognise and accept that this is part of what we now have to consider? Because who got a dog during COVID? See, there's a few, right? And a lot of people, part of where we talk about, you've heard a lot of stuff yesterday about, hybrid working and a whole range of other things. A lot of people don't want to leave their dogs at home now, right? Serious. Now, I'm not saying that everybody should be allowed to have their dog in the workplace because, let's face it, it's not the dog park. You can imagine it would turn into a bit of a mess. But there are some considerations that really do need to have to come in to maybe where there's some benefit in the workplace. And, part of what we also do is some well-being visits around dogs, and I think that's an important thing to have a look at depending on your organisation. So, you've heard this statistic already, right? And I sat up late last night changing my presentation because there was stuff in here that you've already been told, not once, not twice, but about 20 different presentations telling you the same thing. Who didn't realise the employer's responsible for the mental health of their people? Anybody? Anybody not heard the 1 in 5 statistic? Right, the 1 in 5 statistic is one thing, but that was the mental illness statistics prior to COVID. Since COVID, we've got 4 in 5 registering mental health distress, right? So distress means we don't necessarily show up in the world the way that we normally would, and we have to understand what that does, our mental health, how we show up in the workplace. You guys are all dealing with this day in, day out. Can I just stop and correct myself? I'm sorry, I really am trying not to use the word guys because I'm sorry, I'm not a guy last time I checked. But it's something that we tend to do as a collective. So let's try folks or something else. I'm gonna try, I am still learning, all right? But what are the reasons we've got such a big crisis and why I wanna talk to you about trauma-informed people management is because we've got a lack of professionals. Who's the professionals in the room? Who's a mental health practitioner of some sort? Okay. Who didn't know that we had a crisis? Anybody? Anybody? Anybody not know that we've got a health crisis in this country? So in terms of the lack of professionals, just going to the 1 in 5, please remember, that's 5 million people in this country. There are less than 2,500 psychologists in private practice right now, and they are only delivering 350,000 services a year. You do the math. If most people think they're going to get access to 20 services, we've got a massive problem. Less than 1 in 5 mentally ill are being serviced. That's right now. And I don't know if you noticed, but it now takes 6 years for us to train a psychologist. And let me tell you, when they come out of university, and I can say this because I am one, they come out of university without any practical skills. Seriously. Like, they have to get that through their intern placement. So it's a big problem. When we go to the distressed numbers, can I just point out, 1 in 60, that's as much as going to get any form of professional support. So I need you to understand that the reason that I changed my business focus to working with organisations in the last couple of years is because I kind of got tired of the Prime Minister standing up there and saying, just go and see a psychologist. I'm a trauma specialist. I was already having overwhelm with all of the client load that I had, let alone add in pandemic and all the obligations that I'd had, and let alone, hello, single woman lives alone with the dog. Like, yes, is our own mental health actually, is there any reason that we're talking about burnout a lot? Not surprising, right? So there's some big issues here, and we have to understand the bigger issues. So when we start talking about burnout, this is a massive, massive problem in terms of our health practitioners. So when we talk about mental health literacy and building all of these things in your organisations, I need you to understand that actually COVID did the whole community a big benefit. We now talk about mental health much more commonly with our friends. We discuss our distress. We talk about it more openly. The problem is that we still feel like we talk about it, but we don't have the professional skills to help other people. Did you know that being a compassionate human being can go just as far as any kind of professional piece of paper will do? Now, sometimes we get compassion overwhelm and our empathy gets a little bit too triggered. Being self-aware is the next thing I'm going to say to you about helping you to manage. All right, so who am I to talk to you about this stuff? Now, for all the mental health practitioners in the room, I didn't write that headline, they wrote that about me. Probably I'm a maverick, I'm going to say, of mental health. I tend to look at things differently, and I'm always looking for innovation, which also gets me into some trouble, by the way. But working with these organisations, I do provide mental health advice for lots of different organisations, because the ones who aren't big enough to be able to afford their own, chief mental health advisor officer person, sometimes they come to me. But you know what? They come to me usually when they have a problem. It's pretty typical. Did you notice that? Most people will actually call out for help when they realise they've got a problem. We do it as human beings when we, have mental health issues eventually. Like most times, families dragging you kicking and screaming to go and see somebody because they can't handle living with you anymore, right? Trauma, even though I know you're all here hear about all those traumatized stuff and how you deal with those very special people, trauma affects everybody. Trauma is at the basis of our psychopathology. There is not one human being on the planet who has not experienced some level of trauma. Now, I just told you that. Is there anybody in this room that before I said that would not agree with me, or thinks now your brain's kind of going, she doesn't know me, I don't have any trauma? You don't have to put your hand up, I don't really expect you to. But I just want you to notice, because our perception of what trauma is a big part of where this kind of, sense comes from, right? Now, I'm just going to show you, because trauma comes from the ancient Greek. It literally means wound. It is an emotional wound. That's it. When you understand it's an emotional wound, then you can understand what traumatic experiences are. They're the things that upset you, that cause a wound. Now, some wounds, and you'll know this when you've hurt yourself, some wounds we have scabs and we get them picked off or ticked off at different points and it starts to bleed again. And some wounds we are able to actually heal. And different types of psychotherapeutic interventions can help to heal. Some take a band-aid approach, and others, just leave the scab there with no protection and hope that it doesn't fall off. So not all psychological approaches to trauma are as effective as the others. So it's just an important one to just keep in mind. So why am I here talking to you about trauma-informed people management? Who here this week, the last day and a half at least, hasn't heard about culture? We know that our workplace culture has a big impact, but it has a big impact on profitability. We've heard this morning people talking about, how you need to put that information to the leaders. Trust me, I get a lot of people who come to my webinars and do different things around talking about how to improve things in workplaces. It's often the HRMs or it's the people in the wellbeing space. We don't get the leaders in the room. And I know, because I'm preaching to the converted, you're all in here, you're here representing your organisation. How do you take the information back to let them know how big the problem is? And especially when we think that it's not a business problem. But as we've heard, presenteeism is probably a bigger problem than the absenteeism. There are lots of ways that we can assess what the impact is on our organisation. and we need to have a look at it. So when I get called into an organisation, it's usually because there's a problem. Like I said, there's little enthusiasm, there might be a pervasive fear of failure among the staff. I just, by the way, noted any of these that you notice in your own organisation. Constant dysfunction and confusion, gossip and drama. Gossip and drama, man. I'll tell you why it's there. And high staff turnover. So this leads to a sense of individuals looking at, they've got no enthusiasm, they've got this fear of failure, they don't have a plan, they've got distrust. Guess what this is actually really? These are all indicators of a toxic culture. Now, you know, we've heard that we've bandied this around, right? I talk about toxic cultures quite a bit because toxicity is present at a medium or high level in 80% of organisations. That's recent research that came out in the last 12 months. And part of the problem that we have is that we then have 3 ways of approaching a toxic culture as employees. 33% are what we call the active rejectors. They're the ones who will sit there and kind of go, you can't do that to me. Right, I'm going to escalate this, and they'll go up the chain. And look, I'm sure there are a lot of those people in this room, because we are the ones who say you can't do that, that's not right, that's not okay, you know, no, let's go take them to court, do all of that. And I've just written a new book. The manuscript has just been submitted to the publisher last week. It comes out in February, and it's called How to Heal a Workplace. And one of the most distressing things for me in doing this book was actually I'm thinking the Australian context of workers' comp and the way that we approach workers in the workplace is broken. And so I go and look at the international context. Well, lordy me, don't you even start to talk about how our framework legally provides much more support. And you've heard it this morning where they talk about the regulatory framework changes and all of these things. We have legal protections, but let me tell you, one of the problems is that because across all of the jurisdictions we apply it differently, and anybody who was in the Comcare presentation will have heard me raise that issue with the poor lady from Comcare. I'm really sorry about that, but right? What's the issue? Do you know that Comcare, in terms of, it's the only system, they're self-insured against government employees at a federal level. It is the only politicised self-insured system, so they can put in a policy that says we're going to reject all claims at the first level and force people into a denial pathway up through a politicised system. It should never be politicised injuries of workers. Never. Right? And yet we have jurisdictional differences, so much so across this country, it's hard to believe we're even one country. And one of the outcomes about the book that got me really upset was it's because of our legal framework that we actually have worse psychological outcomes, because we tell workers that there is a system that will protect them, and then we don't protect them, we make them fight. And the fight allows them to go into a victim state, and they stay at home and they lay on the couch and they watch Netflix and they order Uber Eats because they don't have to, because they don't feel like it. We are creating a monster. And I'm not saying, as a health practitioner on the flip side, I've got clients that have been in these similar situations. I'm not telling you this because I think that, you know, they've done the wrong thing. In me helping them, maybe have I been party to this system that doesn't work? I'm not saying that it shouldn't be there. I'm saying we need to make sure that it gets enforced in a more proactive way so that employers stop thinking that they can get away without actually taking ownership and responsibility. And that's why one of the areas that I talk about does it really well is Victoria. But there's a reason for that too. They're a small state, they've got a bulk of people in a small geographical area. It's just literally easier to deliver any kind of community service. So going back to this, the 40% of the passive rejectors, the passive rejectors are the ones who will sit there. They're the drama queens from my previous slide. They're the ones who will, it's the same in every organisation, and they just sit and they whinge and they bitch to each other about how bad it is, but they don't do anything about changing it. They won't move, they won't leave it. They are feeding into the toxic culture, right? Because they stay in it and they keep it sort of rotting away, bubbling along. Then there are the 27% of escapees, which are the ones who usually, interestingly, only in the face of very overt toxicity will up and leave. So sexually harassed or obviously bullied. Now, I talk about resilience and the intergenerational issues that we've got. So what we don't talk about a lot, and somebody asked a question, I think it was yesterday, we don't talk a lot about why Gen Zs are so different in the workplace to the way Gen Ys are. And we've got, Gen Zs are the first full digital kind of raised group. They were raised by the Gen Xers like me, who worked, and we were busy, and in my case, the sole parents. So I think I was a bit better with my kids, but I still intervened. If somebody did something to them that wasn't right, I was the one that was down the school going, you can't do that to my child. I didn't actually, I was busy, right? I had to intervene, I had to stand up for their rights. When they had mental health issues in their teens, I was the one that went, there, never mind, let's take you to see the psychologist, let's go and sort it out, let's go and do everything for you. But what did we do? We operantly conditioned them, didn't we, to actually not know how to problem solve their way through their own issues, and we didn't allow them ways to develop a level of resilience. And I need you to understand that, because as Gen X bosses in the workplace, you are now having to reparent the children that you didn't have time to parent in your own household, because they're now showing up in somebody else's workplace and their kids are in yours, and you now got to do it. Hey, great job. So, and we have to sort this out, because the other thing about this generation is that the whole, we talk about the evils of social media, but the external factors are actually why we have this egocentric driven young generation, and they have no resilience, and they will play, and don't get me wrong, I'm not being rude here, but they will play the card, the get out of jail free card, but I'm anxious. There was a story I had with a plumbing company and a young apprentice, and lots of different things. I've got to hurry up, I've got 2 minutes. I better not tell you about the plumber, but better come back to the quick, individual or collective. So the issue here is the benefits of the individual. The individual says it's all about me, but actually we are part of a collective in a workplace, in a community. Going back to the toxicity elements are there because it's in our community. We spend 30% of our waking life at work. 30% of our life is spent sleeping and only 30% with our families. Is there any reason that we need to really focus on this in the workplace? So going to psychosocial hazards, one of the reasons that they cause traumatic impact is because they are either one of two things, and this is what will cause a traumatic injury. They're either about the lack of personal control or the invalidation of the experience, right? So the lack of personal control will lead somebody to, there might be a level of responsibility that comes into it, but when we look at the psychosocial hazards specifically, they've been outlined by, WorkSafe and the rest of it, there is a big part of this about not having control over it or being invalidated in it. And the other thing that usually causes an injury in the workplace is the next level of the trauma stuff, which is where they feel they did something wrong and they took responsibility for it, which is what we see a lot in some of the first responder stuff. It's not just about exposure in terms of trauma. So the EAP is a tertiary intervention. It's too late. Don't think you can just send them off to an external party. You've heard a bit about leadership. There is literally a whole bunch of stuff coming out about the leadership lottery, that your outcomes from a psychological safety perspective in the workplace is 100% dependent on the leader that you have. And if they don't approach it very well, then we've got a problem. So stress management requires a plan. Change management, it's our biggest risk. And the change managing consultants that come in do not do anything to assess the psychological impact of the change on the people. They just don't. They're there to organise the process stuff. They don't do the people side of it. So we have to recognise when we do big change in the organisation, it's a big issue. New leadership. When new leaders come into an organisation, they usually cause problems because they're trying to impress the board with their capacity to do their job really well. But what happens is they need to spend some time just working out the lay of the land before they try going and changing things and making their stamp and doing all of that. Because the biggest reason I get called in is because there's a new leader, and within about 3 months, there is a revolt. Because they're trying to change things, and they're trying to change things too quickly. I've got to finish. New staff, 3 months. You must put not only in your onboarding, but a really detailed support process for the first 3 months of checking in, because most psychological injury claims are made within 3 months of the change, right? So just a couple of things to put in there. There's lots of stuff, you know what I'm saying. Validation, this is the biggest issue that I wrote about in the book. Action validation versus recognition validation. Action validation is assessing that's the investigation. The recognition validation is, I'm really sorry that happened to you, and how can I help? All right. Acknowledge pain, lots of other things. This one I just quickly, that's the SMS system. This is a thing I do with teams to help them work out how they're showing up in the workplace. Really important part that came out of my book. This book, which I've got here, you can get half price today if you want one. I've got a box there afterwards, and there's a whole bunch of other things in here about how we build a resilient workforce. You might want to check your phones 2 seconds. There's the psych injury prevention. You can go to that QR code and have a look for yourself about your organisation. Really geared at a larger organisation. If you're really small, that won't help you. There's 5 key areas that touch on the Black Dog Report. I challenge you to create a psychologically healthy workplace in 2023 because 4 in 5 of your people are being affected. Who worked out my theme? All right, how to heal a workplace. If anybody wants to QR code that one, that's coming in February 2023. You'll be able to get on the mailing list for that bit. And any more information, please go to the website. And thank Angus. I also have some other, these are white papers if anybody's interested on that table after coffee time.
Thank you very much, Kerry. Lots of information there. Very well done with some fast talking. But now some really interesting points to get across, particularly around it. Understanding trauma is a big one, and how to influence that culture. And looking at, for me, I see where you're coming from with that generation sort of difference. Communicating across the generations can be a difficult thing. So definitely some good topics on that. There's some books there by the sounds of it, so make your way over there if you want to after the session.
Is that psych app?